Hello guys, I hope you're well. So a very important point to talk about is the monitoring points for corticosteroids. So here we go. So when long-term corticosteroids are initiated, baseline measurements should be taken. So what are these baseline measurements? HbA1c, BP, BMI, triglycerides, potassium, and height and eye health. So as you can see, corticosteroids have a lot of baseline measurements, and this is very important to talk about. So why is it that we need to have a baseline measurement of potassium, guys? Right? What's the reason? So the reason is because corticosteroids can cause hypokalemia. So this is a very important point to understand. So things like prednisolone and other steroids can potentially cause hypokalemia. So we've also been through the ADRs. So ADRs include immunosuppression, adrenal suppression, diabetes, because of that hyperglycemic risk. And these are a few points. So also with corticosteroids, you need to keep a steroid alert card. It's a bit like how with warfarin you have a card, or with other medications you have a card that's to put INR levels and things like that. And also we know that gradual tapering should be carried out when withdrawing from long-term treatment to reduce the risk of adrenal insufficiency. Crucial point. Now let's quickly go to interactions. So you can imagine if corticosteroids can increase the risk of hypokalemia, then you will understand that diuretics such as furosemide or thiazide diuretics will enhance the risk of hypokalemia. Now, as we've said that corticosteroids hold a immunosuppressive action, you can understand why live vaccines can impair the immune response and increase the risk of severe infection. So it should be postponed for at least 3 months after high-dose corticosteroids are stopped. So you postpone live vaccines even 3 months after the halting of a high-dose corticosteroid. Very important to know. So if you have an antihypertensive and anti-diabetic, you may have reduced effectiveness. Why? Because of the hyperglycemic effect. We've discussed how diuretics that cause hypokalemia will increase the risk of hypokalemia. NSAIDs will increase the risk of GI bleeding, and don't forget that NSAIDs can cause hyperkalemia. Enzyme inhibitors such as the azoles, antifungals, and ritonavir antivirals will lead to increased corticosteroid levels and toxicity. So inducers such as PCR or crap GPs, which is mnemonic, so rifampicin, carbamazepine. Rifampicin can color bodily fluids, don't forget that. So carbamazepine is used for tonic-clonic seizures, which will reduce the effectiveness of corticosteroids. And thank you so much, guys, and take care of yourselves.